How do you calculate fluid amounts for dehydrated children? When a child is dehydrated, figuring out how much fluid they need can seem tricky, but it's based on simple steps backed by medical guidelines. First, healthcare providers assess how dehydrated the child is by looking at signs like weight loss, skin elasticity, dry mouth, and mental alertness. They classify dehydration as mild, moderate, or severe. Mild dehydration involves about 3 to 5% fluid loss, moderate is 6 to 9%, and severe is 10% or more. Next, they estimate the fluid deficit, which is how much fluid the child has lost. This is calculated by multiplying the percentage of dehydration by the child's weight in kilograms, then by 1,000 to get milliliters. For example, if a child weighs 10 kilograms and has 5% dehydration, the deficit is 0.5 times 10 times 1,000, which equals 500 milliliters. This helps determine how much fluid needs to be replaced quickly. During the rehydration phase, the goal is to replace this deficit. For mild dehydration, the recommendation is to give about 50 milliliters per kilogram of oral rehydration solution over 2 hours. For moderate dehydration, it's about 100 milliliters per kilogram over the same time. If the child has severe dehydration or shock, they need immediate intravenous fluids, usually isotonic solutions like Ringer's lactate or normal saline, given in boluses of 20 milliliters per kilogram until they stabilize. Fluids are given in small, frequent amounts orally if tolerated, but if the child cannot drink or is in shock, Roman IV fluids are essential. After the initial rehydration, the focus shifts to maintenance fluids. These replace ongoing losses and meet daily needs. The common method used is the Holiday-Seger formula, which suggests giving 100 milliliters per kilogram per day for the first 10 kilograms of weight, 50 milliliters per kilogram for the next 10 kilograms, and 20 milliliters per kilogram for any weight above 20 kilograms. For example, a 15-kilogram child would need about 1,500 milliliters daily. Also, half of the remaining fluid deficit should be replaced over the first 8 hours, with the rest over the following 16 hours. It's important to account for ongoing losses from vomiting or diarrhea and adjust fluids accordingly. Special considerations include using reduced osmolarity oral rehydration solutions with about 75 milliequivalents per liter of sodium, especially in children with ongoing losses. Monitoring serum sodium levels is crucial to avoid hyponatremia or hypernatremia. For infants under 6 months, sometimes extra water is added to the oars, but this should always be done under medical supervision. Medications like ondansetron can help reduce vomiting and improve the child's ability to tolerate fluids. In summary, managing dehydration involves estimating how much fluid the child has lost, replacing that amount quickly during rehydration, then maintaining their daily fluid needs with carefully calculated ongoing replacements. It's essential to monitor the child closely throughout treatment, reassessing regularly to ensure they are rehydrating properly and avoiding complications. Always remember, consulting healthcare professionals is key to tailoring treatment to each child's specific needs.